In 1983, at the age of 25, Elizabeth Bouvia was admitted to Riverside General Hospital in California as a voluntary suicidal patient. Bouvia described her wishes as wanting to be left alone and not bothered by friends or family or anyone else and to ultimately starve to death. She said that death is letting go of all burdens. It is being able to be free of my physical disability and mental struggle to live. Almost completely paralyzed from cerebral palsy, Elizabeth Bouvier had never been capable of using her legs. She could move her right hand to control her battery-powered wheelchair, as well as her facial muscles to chew, swallow, and speak. Along with the majority of her body being paralyzed, Mrs. Elizabeth Bouvier also suffered from painful, severe degenerative arthritis. Under the supervised treatment of Riverside's chief of psychiatry, Donald Fisher, Bouvia was not permitted to go through with her plans. Fisher refused to let Miss Bouvia starve herself and instead chose to force feed her because he believed that she might regret her choice. In a hearing before California probate judge John Hughes, Fisher stated that the court cannot order me to be a murderer nor to conspire with my staff and employees to murder Elizabeth. Elizabeth Bouvia was not a woman of much luck. At the young age of 5, her parents divorced. Her mother raised her for 5 years and then decided to put her in a children's home. At the age of 18, Elizabeth's father abandoned her, telling her he would no longer be taking care of her because of her disabilities. Elizabeth Bouvia did a remarkable thing after this. She attended San Diego State University and graduated with a bachelor's degree in 1981. She was capable of living on her own in an apartment with a live-in nurse, funded by her requisite amount of state aid. Unfortunately, Elizabeth had no luck finding a job after college. For 8 months, she worked as a volunteer in the San Diego Placement Program, but was never compensated for the work she had done and was never offered a position of employment. 1 year before she entered the doors of Riverside Hospital, her husband, ex-convict Richard Bouvia, abandoned her because he did not find himself suitable to care for her disabilities, and because she had suffered a miscarriage and Elizabeth's family refused to accept him as well as help them with their money issues. Bouvia's case is not a conventional physician-assisted death case. Miss Elizabeth Bouvia did not have a tragic terminal illness that would diminish the quality of her life greatly, leaving her little time to live. She was a mentally capable adult who sought independence and the choice a safe death that would put her out of her severe pain and misery. Seeing as Elizabeth Bouvia was virtually left to fend for herself and receive poor treatment due to her disability starting from a very young age, it is not hard to understand where she is coming from and why it was that she decided to terminate her life. However, if we were to let Elizabeth Bouvia starve herself to death under government aid, this could cause severe issues of prejudice in U.S. laws that would seem to not value the lives of the disabled. In the 6 states where physician-assisted death is legal, Montana, Oregon, California, Washington, Colorado, and Vermont, patients must have a terminal illness that leaves them with only 6 months to live. This is a very specific time period where the end guarantees a death due to an illness that can neither be cured nor helped. To permit someone who doesn't meet this legal requirement of physician-assisted death could cause issues when it comes to creating a specific, easy-to-follow boundary of when we should permit physicians to help patients end their lives. If Judge John Hughes had permitted Bouvia to terminate her life under the care of Donald Fisher, then it is very possible that other disabled people could follow her footsteps and choose to end their lives as well with the assistance of physicians because they no longer wish to live with their disability, just as Elizabeth Bouvia did. But would Hughes be imposing on Elizabeth Bouvia's autonomy by refusing her wishes and allowing Dr. Fisher to continue to force feed her? In my concerned, informed opinion, I think the doctors did the right thing in not making hasty decisions and refusing to follow through with Bouvia's wishes. I believe that doctors and medical staff had originally used care ethics to make their judgments of this case. They refused to aid Elizabeth in dying out of beneficence. They wanted to make sure Elizabeth lived because they believed she might regret her decision, and they wanted her to try to enjoy her life. After living her whole life being told by her loved ones that they didn't want to take care of her due to her disabilities, it is very easy for Elizabeth to be influenced by these hurtful words and series of abandonments and come to the conclusion that maybe she'd be better off dead if no one wanted to take care of her. However, I believe this is where perseverance is important, as well as therapy and psychological advising from professionals with her best interests in mind. I agree with the notion completely, but I disagree with the continuous force-feeding Elizabeth Bouvia had to endure in several hospitals. Judge Hughes ultimately allowed the force-feeding under Donald Fisher's supervision to continue, ruling that because Elizabeth was not terminally ill and could live for decades, there was no other reasonable option. Elizabeth appealed, but the force-feeding continued. It wasn't until the California Court of Appeal ruled in her favor, claiming that the court mistakenly attached undue importance to the amount of time possibly available to her and failed to give equal weight and consideration for the quality of that life, and equal, if not more, significant consideration. Elizabeth's mental and emotional feelings were not given the respect they were entitled to, and she had been subjected to the forced intrusion of alien objects into her body against her will. These dehumanizing actions violate Elizabeth Bouvia's autonomy and right to privacy. Elizabeth, a competent adult patient, had the right to refuse treatment and eventually won her case. As for the physician-assisted death aspect of this case and how it fits into our world today, I don't believe that disabled should be allowed to participate in physician-assisted suicide purely because of their disability or long-time pain. Although Elizabeth Bouvia's case ruling claimed that it was legal for Elizabeth to refuse medical aid from a doctor as a form of reaching death faster, it is important to clarify that this in no way applies to physician-assisted suicide. Physician-assisted suicide is when a physician provides his or her patient with means to kill themselves. If Bouvia had been given a lethal dose of drugs by her doctor, quickly killing her after she had taken them, this would have been a more problematic case due to the prescribed medicine involved. Anyone can refuse medical treatment, but not just anybody can go through with physician-assisted suicide, and this is something that I believe should remain this way. To refuse aid takes a little more effort. There's more time to think about the decision, there are opportunities to take back your word, and there are chances to change your mind. Whereas, if anyone with any kind of discomfort, pain, or disability was given the lethal dose when they said they wanted to die, this would not give them this chance to reevaluate their decisions. Elizabeth Bouvia, in the end of her case, decided to live. Not because her disability and pain magically went away, but because, for once, she was given the choice to let herself die, and this independence revived her will to live in some sense. That's why I believe physician-assisted suicide should be allowed only to those who have been given a maximum amount of 6 months to live. The lethal doses prescribed by doctors to their patients that qualify for physician-assisted suicide have the ability to kill the patient the same day they take the drugs, meaning that death is guaranteed when going through with this process. Only patients with little time left in the world should be considered for this, because patients that have a longer time on earth, even those in severe pain, might find themselves wanting to stick around a bit longer than they think.